That increase in thoracic volume vertically causes the thorax to enlarge. Again, air in the atmosphere says, oh baby, a low pressure system. That's where I'm going. So air rushes from a high pressure to a low pressure system to fill the lungs with air. And it pushes the diaphragm down, 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 down. And the diaphragm moving from a higher position to that of a lower position. I'm exaggerating because I'm Irish and I can do that. Expiration should be passive. When a person's doing exercise and we try to optimize their breath, and I think Pilates does just that, it optimizes breath. We see the magnificent and very thin muscle and the way by which it works. It's almost like a parachute, you might say, that is almost as thin as a parachute, but it has fantastic force-generating capacity. And I think one important component of Pilates is when Pilates is done with a breathing emphasis or a breathing focus, it has the capacity to improve the strength, the endurance, and the work capacity of this important muscle. And all of the other muscles if they are called into action by doing Pilates in a certain way. It's essentially a pump at the base of the lungs. Or if I bend backwards, I will influence the action of my diaphragm. It's because this component of the pelvic floor is critical in regards to maintaining proper breath and proper alignment and proper force generation to allow us to breathe optimally. And that decrease in intrathoracic pressure not only facilitates inspiration, but it facilitates venous return. A critical component, I believe, in Pilates. And I think Pilates has the capacity to improve inspiratory and expiratory muscle strength. Does anyone know how we can tell whether or not the diaphragm is contracting or not in ourselves or our patients? If we were to all take a full deep breath right now. What did you see me do? Did I raise like I said was abnormal? I did. Have any of you ever done this after a marathon or after you've worked really, really hard exercising? What's up with that? Why the trunk flexion with hands on knees? Actually stabilizing yourself in such a way that you no longer have to use that accessory muscle or that primary muscle of breathing as an accessory muscle for stabilization. So you stabilize yourself, and what does that do to a fatiguing diaphragm? We know when a muscle fatigues, it doesn't stretch well, nor does it contract well. We now give it a stretch upward, and we lengthen the diaphragm muscle fibers. So now the muscle's sitting a little bit higher, and even though it needs to work against the abdominal contents, a muscle loves to be stretched. So I'd like you to think about blood flow to the heart with breathing. Because the last time I traveled, when I did this, blood splurted out of my eye and hit the person right directly in front of me. What was I just doing? A Valsalva, a Hans and Franz. Anybody remember that? A heart that contracts like yours and mine, contracts like this. A person with a failing heart, because they've had repeated heart attacks, their heart contracts like this. That will give you your maximal inspiratory or expiratory pressures. And that gives us a chance to look at the strength of inspiratory and expiratory muscles. We look at the whole range of inspiration, which I think is critically important for me as a researcher and a clinician. In a horizontal position, we do not have gravity facilitating diaphragm descent, but it's still a wonderful way to train the respiratory muscles. Almost every Pilates exercise substantially increases venous return. With the studies I've done in rowers, there's a tremendous increase in filling as the rower gets into this position. If we try to fill it with too much of this, where a heart's already overfilled, we're going to make the heart perform poorly. We want to extend and allow that heart to have more blood propelled forward, not filling. So we can hopefully optimize cardiovascular performance by using the Pilates equipment in a way that really facilitates better optimal cardiovascular function. And I think it's possible from what I have seen in regards to the use of equipment with Pilates.
Very good.
That's a workout. I wish that it's amazing what he does. I wish he would have had his shirt off so that you could actually see what's taking place in regards to his inspiratory and expiratory muscles. We looked at inspiratory muscle performance. Some of you may have participated in female Pilates instructors at the 2012 Pilates Method Alliance meeting in Las Vegas this past, I guess it was November. And we used this device, which I've already talked to you about, to measure breathing muscle strength and essentially work of breathing, work under the curve. I was concerned about this finding, these two findings, a significant Pilates experience in years and a lower SMIP, and lifetime Pilates and a lower maximal inspiratory pressure. And I think that's up for further investigation. What methods of Pilates breathing are most effective for particular patient populations or for particular outcomes? And I would love to work with Brent, Sherry, and all of you to further understand that particular component of Pilates breathing and improve the quality of life and the return of life in our subjects, our clients, and ourselves. Thank you.